there's a couple of things that are really interesting about, and I think concerning about this case in terms of PSA. PSA is a really good marker for our patients of disease response, but it's also a very worrisome prognostic marker of a lack of response. There's a nice study done by the SWOG group that demonstrated that patients who start primary hormonotherapy and don't drop their PSA to less than 4 have a very poor outcome and prognosis. So patients like that, they rapidly progress into castrate-resistant and die early from this disease. So this is a type of patient that may have fit that profile, and that would raise my concerns that they're going to have an accelerated course, and we're going to need to think about layering our therapies because we may not be able to get through 5 different disease progressions to use each treatment modality we have as a monotherapy. The enzalutamide use in this patient was actually a little bit ahead of its time. This patient presented with a rapidly rising PSA. Within just a few months, this PSA went from a very low level up to 47. And in that space of time, the patient hadn't yet developed bone metastasis by the standard CT and bone scan. What we know now is that's a patient probably, if we're going to use molecular imaging like PSMA PET or Axumin PET, that we might actually see that metastatic disease burden better. But it was probably evolving so quickly that it wasn't there yet. These are exactly the kind of patients with very short PSA doubling times that were enrolled in the trials like Prosper and Spartan that demonstrated the clinical benefits associated with enzalutamide or apalutamide. In 2016, that would have been enzalutamide that's available. And I think rightly this patient was treated proactively for those kinds of complications. What's interesting and what wasn't commonly seen in those studies is patients having a relatively short response. So within 6 months, this patient developed metastatic disease. We saw that in the placebo arms, not as much in the treatment arms, but it really speaks to sort of the inherent resistance to mechanisms like enzalutamide and the lack of dependence of this patient's particular tumor on the androgen receptor pathway.